This video will cover how to obtain intravenous access. Normally you do everything on this list, but to keep things concise, we'll focus on the steps in blue, and we'll also cover how to choose an insertion site and include a summary. As a word of caution, we're not covering every possible type of equipment on the market. Make sure you understand how your own equipment works and how it may affect your procedure. In this video, we use a blood control IV catheter. If you're not using this type of catheter, you will have to occlude the vein and attach a flush syringe prior to applying the dressing, as blood will flow continuously through the catheter until occluded.
As with any procedure, don't forget to wash your hands, introduce yourself to the client, explain the procedure, and receive consent.
Here's the equipment you'll need: a sharps container, a tourniquet, antiseptic swabs, an intravenous catheter, a saline flush, a sterile dressing, some tape, and the drip set. You'll also need T-tubing and a saline lock. Start by preparing the drip set. After you've removed the tubing from the packaging, ensure that all the connections and protective covers are secure, as some of them may have loosened during packaging or transport. Set the roller clamp to the off position. Write your initials and the date and time on the label and attach it to the new tubing just below the drip chamber. This way, you won't forget about it later. Now, remove the protective covering from the port on the infusion bag. Then, remove the cap from the spike on the tubing, invert the infusion bag, and insert the spike into the port, being very careful not to contaminate the spike. Hang the bag from the IV pole and, once again, label the infusion bag with your initials and the date and time. Gently squeeze the drip chamber to fill it up about halfway with the solution. Then, slowly open the roller clamp to allow the solution to fill with the tubing. This is called priming. If solution doesn't flow into the tubing, you may need to loosen up the cap on the other end of the line. If that's the case, be aware that some of the solution may leak out and aim to do so over a sink. Finally, double check there are no air bubbles in the new tubing and set the roller clamp back to the off position. Next, place a tourniquet around the arm, 4 to 6 inches or 10 to 15 centimeters above your expected insertion site. Choose a vein on the dorsal or ventral surface of the arm, but not too close to the wrist. Pick a well-dilated vein if possible. Gently palpate the vein to get a better idea of its location. A good vein should feel soft and bouncy. Now, release the tourniquet to restore blood flow. Make sure the infusion bag is nearby. Reapply the tourniquet 4 to 6 inches or 10 to 15 centimeters above the chosen site of insertion. Clean the insertion site with chlorhexidine or other antiseptic. Use the first swab to clean side to side, the second swab to clean up and down, and the third swab to clean in a circular motion. Allow it to dry completely, which may take a few seconds, and then apply topical anesthetic if needed. Anchor the vein with your thumb by pulling the skin away from the direction of insertion. If using an over-the-needle catheter, hold the needle in your dominant hand like you would holding a pencil. Insert the needle at a 10 to 30 degree angle with the bevel facing up. That's important. Remember, the goal here is to puncture the needle into the vein and maintain it within the lumen of the vessel. Adjust your angle accordingly to accomplish this task. You don't want to puncture through the back wall of the blood vessel, so usually a less steep angle is the way to accomplish this. Wait until you see blood return in the flashback chamber. Bingo. Lower and thread the catheter until it's almost flush with the skin. Stabilize the needle, loosen the stylet, and advance the catheter into the vein, pushing until the hub almost reaches the site of insertion. If you can't advance the catheter, try the floating technique by flushing the apparatus with saline solution as you push. Otherwise, flush the apparatus with saline solution once the catheter is already in place. Remove the needle and stylet and activate the safety device on the stylet. Hold the catheter steady with one hand while you release the tourniquet with the second hand. Now, apply a clear, sterile dressing to the site. If available, attach a hub or saline lock to the catheter and flush with normal saline to assess patency. The saline should flow in easily. Observe for any swelling, which would indicate the catheter is not in the vein. If this happens, you'll need to remove the IV and start over at a new site. Now, remove the cap from the infusion tubing and attach it to the hub or saline lock. Then use the roller clamp to set the rate of infusion. Then secure the catheter with an adhesive strip over the hub. Remember, protocols for securing the catheter may differ. Finally, don't forget to place the stylet into the sharps container and label the dressing per your local protocol. When choosing an insertion site, aim to use the patient's non-dominant arm. Start at the hand and work upwards. Hand veins like the metacarpal and dorsal veins work very well for 22 and 20 gauge catheters. For larger catheters as big as 16 gauge, use a cephalic, accessory, or basalic veins. It can be easy to obtain access to the antecubital veins, but they're often a little restrictive to the patient's movement. In pediatric individuals and neonates, the feet, ankles, and hands are commonly used. In any case, you want to choose a healthy part of the body.
Avoid edematous or burnt areas, since that can result in extravasation or poor flow.
Avoid infected areas to prevent bacteremia or thrombosis, and also avoid recent fracture sites or areas affected by trauma. Finally, avoid sites distal to a previous venipuncture site. This is important if your first attempt is unsuccessful. Always remember to move up the arm, not down it. This is to avoid fluids or medication from leaking out a previous puncture site as blood moves towards the heart. To help veins pop, ask the individual to clench and release their fist a few times. Also try lowering the arm and gently tapping or stroking the veins from distal to proximal. Warming the arm with a warm, damp cloth or heat pack can also be an effective tool. If you're having difficulties guiding the needle into a vein, try using ultrasound guidance. Apply a liberal amount of non-sterile gel to the probe and cover with a sterile dressing. Run the probe over the arm and you should be able to locate the veins on the display. To help find veins, another approach is to use a translumination device. Run the powerful light across the arm to find the vein, then run the light down the arm to follow the vein.